Hello, I am Dr. Praveen Kedia, myself orthopedician practicing in Rajasthan, Jhunjhunu district. Today we are discussing about the importance of physical activity and its effect on final outcome of rheumatoid arthritis and osteoarthritis. There is increasing trend which is going on about the importance of physical activity on the patient's treatment modalities during the treatment. If the patient is doing good physical activity, it finally the final outcome of the rheumatoid arthritis and osteoarthritis treatment affects, because if the patient is physically active, physically mobile, he is doing good stretching and regular exercises, he will need less medications for the osteoarthritis and rheumatoid arthritis treatment. Because if the patient is mobile, he is good in stretching, good treatment, is good in physical mobility, then the effect of the osteoarthritis and rheumatoid arthritis on the joints and muscles is will be less. Side effects of the medicines will be less. So there is increasing trend to motivate the patient for regular physical activity, regular exercises, so that the medicine requirement is also less for these people. The best treatment modalities at now all over the world is to add a physical therapy or physiotherapy session along with the medicines to give a holistic approach to the treatment for the patients of rheumatoid arthritis and osteoarthritis. So the best therapy for these patients is to add on the physical therapy, which can be adjusted according to the patient's age, patient's occupation, patient sex, for the medical management of the patients. If we are doing conservative management of osteoarthritis and rheumatoid arthritis, and basically regular exercise and physical activity are very good in the chronic pain treatment. In acute treatment, we need medications to relieve the pain, but in chronic treatment, like chronic conditions in osteoarthritis and rheumatoid arthritis, we will need a regular physical therapy. So that regular physical therapy will keep the muscle strength, keep the joints mobile, and it will also relieve the pain. Because in pain management, there is growing trend among the physicians and orthopedicians that we have to keep the NSAIDs or pain medications to the lowest, so that there will be no side effects on the kidney and whole body system. So there is also growing, what to say, a growing trend among the physicians and orthopedicians to increase patients' mobility and physical therapy. And if the patient is not mobile, he is very senile, he is not doing any physical therapy, then there will be increased demand in medications. There will be flare-ups of osteoarthritis and rheumatoid arthritis, and that will lead to increase in demand of the medications and increase in the complications of the osteoarthritis and rheumatoid arthritis to the patient. So the best strategy for the treatment in osteoarthritis in rheumatoid arthritis is medications along with a specialized individualized treatment of physical therapy and rehabilitation for the patient. And these can be lifestyle modifications, these can be regular exercises, these can be regular physical therapy sessions for the patient, and which can be outdoor and indoor both. In outdoor therapies, we can ask the patient for prolonged walking, prolonged stretching exercise at outdoor. In indoor services, we have the patient for regular indoor physical therapy sessions, and this will improve the regular final outcome of the patient, and it will enhance our patient's confidence building for the treatment and his faith in the treatment, because it will give him very good pain relief, very good treatment related orientation. And because physical therapy and regular physical exercises will also keep the patient weight, patient's motivation level, his brain activities also will be improved. Patient, if the patient is doing less physical therapy, less exercises, then the patient, there are more chances that the patient will also have mental problems like psychological problem. He will have also, these patients who are less mobile, less physically active also happen to be having depression, cachexia, all these things. So it is our duty as a physician, as a orthopedician, as a treating doctor for the rheumatoid arthritis and osteoarthritis, that we should motivate the patient for regular physical therapy along with the medications. Because in these type of conditions, only medications is not a treatment. We have to add on physical therapy individualized according to the patient's age, sex, his activity level. We have to improve his activity level. We have to motivate him to do a regular physical therapy, regular physiotherapy, mobility, regular walking according to the patient, so that individual patient is beneficial. The patient has to get benefit for his physical therapy, and it will improve the outcome of the, and along with the rheumatoid arthritis and osteoarthritis outcome, the patient will generalized well-being of the patient will also be improved. So it is our duty that we have to improve the patient's outcome in rheumatoid arthritis and osteoarthritis. So I think as an orthopedician, as a treating doctor, for my patients and for all other patients, that we have to improve the patient's physical therapy, physical mobility, and this is very good aspect of the treatment. Not just medications, not just surgical treatment. Even after post surgical treatment, physiotherapeutic session is very important. So my stress is that we have to build a patient confidence for doing regular physiotherapy. Thank you.